What if I told you that the very pills meant to guard your health might be quietly opening a door to danger? It's a startling thought. Yet, for millions of older adults, this quiet risk is a daily reality. You are careful. You trust your doctor. You take your medications each day, believing they are a shield for your heart, your brain, your very life. But sometimes, despite the best of intentions, a shield can become a burden. Why does this happen? Because as we journey through life, our bodies change. The way we process medication at 70 is not the same as it was at 40. A dose that once healed might now hit harder or linger longer. This isn't a call to abandon medicine. It's a call to ask questions, to ensure the treatments you rely on are still the right ones for you. Today, we will explore the common medications that could, under certain conditions, increase the risk of a stroke, especially for those over 60. This is not to create fear, but to empower you. To give you the knowledge to have the right conversations, make informed choices, and reclaim control of your health, one thoughtful step at a time. If you've ever wondered whether your prescriptions are truly serving you, type 1 in the comments. If you believe this is simply an unavoidable part of aging, type 0. And be sure to subscribe to Health 365 for more insights designed to protect what matters most. Our journey begins in a place familiar to us all, the medicine cabinet. Inside, you might find ibuprofen, naproxen, or diclofenac. These are known as NSAIDs, or non-steroidal anti-inflammatory drugs. We reach for them to quiet the protest of aching joints, a strained back, or an arthritis flare-up. They are easy to get and often seen as harmless. But for an aging body, they can conceal a hidden threat. Here is the subtle tension. While these drugs reduce inflammation, they can also increase blood pressure. They can cause the body to hold on to fluid, putting a strain on the kidneys and forcing the heart to work harder. Over time, this quiet pressure builds, raising the risk of heart attack and stroke, particularly with regular long-term use. A landmark study in the British Medical Journal tracked thousands of older adults. The findings were clear. Those over 65 using NSAIDs daily faced a significantly higher risk of ischemic stroke, the kind caused by a blockage of blood flow to the brain. The most difficult part is that the warning signs, rising blood pressure, or a struggling kidney, are often silent. You may feel nothing at all until the day something serious happens. This is why the connection between a daily pain reliever and a future emergency can be so easy to miss. So, what can you do? First, do not panic, but do not ignore the risk. Speak with your doctor about how often you rely on NSAIDs. Ask if there are safer alternatives for your pain, like physical therapy or topical treatments. And never assume that over-the-counter means without risk. From the pill we take for pain, we turn to one many take for prevention. Low-dose aspirin has long been hailed as a simple, daily shield against heart attacks and strokes. But in a cruel twist of physiology, for many older adults, that shield can become a weapon, raising the risk of a dangerous brain bleed. Aspirin works by thinning the blood to prevent clots, and that sounds like a good thing. But blood that is too thin can also leak more easily from fragile vessels, especially in the brain. This can lead to a hemorrhagic stroke, a far more dangerous type caused by bleeding instead of a blockage. For someone over 60 without a history of heart disease, the risks of a daily aspirin can now outweigh the benefits. A major study in the journal Neurology revealed a 38% increased risk of brain bleeding in older adults taking aspirin without a specific medical reason. Perhaps you started taking it years ago on the advice that it was heart healthy. But medical understanding evolves. The U.S. Preventive Services Task Force now advises against starting routine aspirin for prevention in adults over 60. For many, it's a risk that is no longer worth taking. The signs of a bleed can be subtle: a sudden headache, confusion, or weakness. And if you're also taking NSAIDs or other blood thinners, the danger is multiplied. So don't stop on your own. Instead, make it a priority at your next doctor's visit. Ask the simple question: is this still right for me? True health protection means adapting the plan as your body changes. Now we shift our focus to medications used to manage behavior, which carry serious risks for the aging brain. In the fog of dementia, where reality can blur, antipsychotic drugs are sometimes used to calm agitation or ease aggressive behavior. Medications like risperidone or olanzapine might seem to help in the moment, but they come with a deeply concerning shadow: a significantly higher chance of stroke and even death. Studies have shown that for seniors with cognitive decline, these powerful drugs can do more harm than good. A major report in the New England Journal of Medicine found that elderly dementia patients on antipsychotics had more than double the risk of stroke. Even more troubling, the same group had a higher rate of sudden death. Why? These drugs can affect blood pressure, heart rhythm, and the brain's ability to handle stress. They sedate the mind, which can lead to falls, changes in blood flow, or dangerously low oxygen levels, all of which are perilous for someone already vulnerable. Imagine a kind, elderly man in a care facility who becomes agitated. He is given an antipsychotic to calm him. Days later, he is found unresponsive. It wasn't the progression of his dementia. It was a preventable drug reaction. If you or a loved one is taking these medications, especially with dementia, never stop them abruptly. But do ask the essential question: is there another way? Sometimes a change in environment or routine can offer the same peace without the devastating side effects. From the mind's confusion, we turn to the body's need for rest. Benzodiazepines like lorazepam, diazepam, or alprazolam are often prescribed for anxiety or insomnia. They promise a gentle descent into calm, a quiet night's sleep. But as we age, that gentle descent can become a treacherous slope. These medications slow brain activity, leading to drowsiness, dizziness, and poor coordination. For an older adult, this is a recipe for a dangerous fall. And a serious fall is no longer a simple event. A head injury can cause bleeding in the brain, triggering a stroke. A study in JAMA Internal Medicine found that seniors using benzodiazepines had a much higher risk of emergency room visits for falls and brain injuries. These drugs also interfere with breathing and blood pressure, especially when combined with opioids, a combination that can dangerously reduce the oxygen reaching the brain. Over time, that stress takes a toll. What should you do? Never stop suddenly. But talk to your doctor. Ask if a lower dose is possible, or if non-drug approaches like relaxation therapy might be a safer path to peace and rest. And the danger is magnified when another powerful class of drugs enters the picture: opioids. Medications like oxycodone or hydrocodone are masters of silencing pain. But for older adults, their power comes at a cost, especially when taken long-term. Opioids slow the entire body. They can cause confusion, drowsiness, and a drop in blood pressure. When your blood pressure falls too low, your brain may not get the oxygen it needs. This can damage brain cells and, in severe cases, trigger a stroke. The risk multiplies when opioids are mixed with benzodiazepines. A study from the BMJ found this combination dramatically raises the risk of respiratory depression, a state where breathing becomes too slow, oxygen levels plummet, and the brain begins to suffer. If you are taking opioids regularly, ask your doctor to review your entire medication list. Inquire about safer alternatives for managing pain. Your safety depends on it. Now, let's move from managing pain to managing the very fuel of our bodies: blood sugar. If you live with type 2 diabetes, you may be taking a sulfonylurea like glipizide or gliburide. These drugs work by prompting the pancreas to release more insulin. But in older bodies, this push can be too strong, causing blood sugar to plummet. And that's where the danger begins. Low blood sugar, or hypoglycemia, doesn't just make you feel shaky. It can cause confusion, dizziness, and fainting. When blood sugar crashes, the brain is starved of glucose, its essential fuel. Under this stress, brain cells can be damaged, potentially leading to an ischemic stroke. A study in diabetes care found that older adults on these medications who experienced severe hypoglycemia had a significantly higher risk of stroke over time. The challenge is that older adults often don't feel the warning signs as strongly. The symptoms can be a quiet whisper instead of a shout, making a sudden crash even more dangerous. If you are on these medications, speak with your doctor. Ask if a different class of drug might be safer for you, and always ensure you eat regular meals to keep your blood sugar stable. Just as we manage our physical health, we tend to our emotional well-being. SSRIs, such as sertraline or fluoxetine, can be life-changing for those with depression or anxiety. But they carry a little-known risk. They can affect your blood's ability to clot. SSRIs make platelets, the cells that stop bleeding, less sticky. This can become a serious problem when combined with other drugs that do the same thing, like NSAIDs or aspirin. The result is a much higher risk of internal bleeding, including inside the skull. One large study found that older adults taking both SSRIs and NSAIDs had a 75% higher risk of serious gastrointestinal bleeding and a notable increase in the risk of a brain bleed. What was once safe in isolation becomes risky in combination. If you are on an SSRI, always check with your doctor before adding any new medication, even an over-the-counter one. This brings us to the very fortress of our health: the heart. Medications that control blood pressure, like beta blockers or diuretics, are often lifesavers. But when multiple heart medications are used together without careful monitoring, their combined strength can sometimes lower blood pressure too much. When that happens, the tiny, delicate vessels deep inside the brain don't get enough blood flow. This can lead to small vessel strokes, the silent thieves that can quietly steal memory, balance, and personality over time. Ask your doctor to review all your heart medications as a single system. Report any feelings of dizziness or lightheadedness, as they could be a sign that your pressure is too low. Finally, we arrive at a risk that isn't about one single pill, but the weight of them all. It's called polypharmacy, taking 5 or more medications a day. With each pill added to the regimen, the risk of interactions, side effects, and falls goes up. One drug might thin your blood, another might lower your pressure, and a third might affect your balance. Together, they create a perfect storm for a stroke-related event. At least once a year, ask your doctor or pharmacist for a full medication review. Ask the simple question, do I still need all of these? Getting older does not mean giving up control. It means asking better questions. It means staying curious. And it means working with your doctor to ensure that every pill you take is truly helping, not quietly harming. Medications are tools, and they can save lives, but only when used wisely. So do not stop your medications on your own. But do speak up. Be an active partner in your own care. Your health is a living story, and you are its most important author. If this video has given you a new perspective, type 1 in the comments. If not yet, type 0. And please subscribe to Health 365. We're here to help you navigate your health journey every step of the way.